When we hear the words plastic surgery, the thought of a long recovery can come to mind. However, that's not the case with some new procedures. Dr. Thomas Jeneby is here to tell us more with his patient. Welcome.
Thank you very much,
Thanks
Lauren.
for coming, doctor.
Pleasure.
Thanks for coming, Mary.
Thank you.
All right, let's first talk about, there's so many new developments in plastic surgery.
Yes.
But we're going to first talk about what there is new for the face, because that's the first thing people see is probably your face, your skin, right?
Right.
So let's hear about this thing called Smart Zide. Am I pronouncing it
Smart
correctly?
Zide's right.
Okay.
Yeah.
Tell us about that.
The original CO2 resurfacing lasers were very hard on the skin because they would do a burn, and the burn would take a long time, and you'd take a long time to get over that burn. The newest laser treatments don't burn the entire skin, they burn only dots.
Interesting.
So there's healing skin between the dots, and so that heals the burn.
I remember seeing when people would get laser treatments, like a face, they'd walk out and just be beet red,
That's
right? And
right.
they'd have a few
Yeah.
days that they wouldn't be able to like see the sun or something like that.
Yeah, exactly.
So it's not like that anymore.
No. I have people coming in on a Friday and going back to work on a Monday.
Really?
Right.
Okay, so it's pretty quick turnaround.
Absolutely.
So then, Mary, you've had this treatment then?
I've had it done, yes.
Tell us a little bit about your experience.
Well, it was really quite pleasant. It wasn't as bad as I thought it was going to be, and I was just really worried about, you know, fine lines, and around my eyes and around my mouth, and it just really did really well for myself, for my skin.
Okay, so it was not something dramatic in but it was just little tiny things that you can't get rid of with makeup.
Exactly, and I don't wear makeup now. After the treatment, I haven't worn any makeup.
Well,
it's just really improved my skin.
Your skin looks beautiful. And how
Thank
long
you.
ago did you have that
About
done?
6 weeks ago.
Okay, wow. So then, Dr. Jeneby, who is a good candidate for this?
I always say everybody's a good candidate for skincare.
That's true.
So one thing you can do if you're not ready to spend a lot of money on yourself, then these procedures are relatively easy. They're outpatient. They're done in the office under local.
And then let's look at pictures of Mary. Actually, I believe we have her before.
Yes.
And describe what you're seeing here, Doctor.
Mary at that point had a lot of sagging skin, wrinkles, and pigmentation problems. And she elected to be one of the first patients of mine to have the procedure. And 6 weeks now, she's not wearing any makeup. We've taken care of her eyes. That was actually, that picture is at 5 days. So you could see, you could be at work.
Wow.
You just need a little bit of makeup.
Nobody will even know what you did.
No, exactly. Now look at her skin. This is without any makeup. Told her to come in.
Wow.
And,
Mary, did it hurt on your skin?
A little bit, not much. It was not really that uncomfortable.
So do you need X amount of treatments or anything like that?
That's a good question. Depends on the downtime, you tell me.
Okay.
If you want to have little downtime, you get 2 or 3 smaller treatments rather than a large.
I see. And then how long will the results last? Will it be the rest of your life?
As long as you take care of your skin, you use some skin, sunblock and skincare, you should be fine.
Okay, let's look at another set of pictures that we have that are before and after. Now I believe, is this called
That's an
rosacea?
after, yeah.
Oh, okay. I was
we
going to
can-
say she doesn't
there it
even
is.
look very, she doesn't look
good.
bad at all, but here's
All
our
right, this
before.
is a 38-year-old patient who had sun damage, freckling,
damage.
wrinkling around the eyes. She actually wanted to get an eyelid lift, but after the laser therapy and about 2 months later, her after picture's coming up, and we've cured her of about 80% of her freckles, her wrinkling, and smoothing out of her skin. She's extremely happy. She's, I think, the second patient I performed this procedure on. There's only 7 of these lasers in the country.
Amazing, and you have it right here in San
Right.
Antonio. Wow, very impressive. Okay, so once you get the skin taken care of, every woman out there knows that they don't feel like their body is perfect. There's brand new developments in liposuction as well, right?
Yes, about 2 years ago, the FDA cleared laser-assisted liposuction.
And this is called Smart Lipo?
Smart lipo,
Okay.
yes. And
How is it different than traditional?
well, Smart Lipo uses a very tiny cannula, maybe a millimeter. A cannula is just something that inserts into the body. You can do it under local. You have a little oral sedation. We drive you in and we drive you back out, and you're completely awake.
So you're awake during the whole procedure?
Yes. Actually, sometimes people talking on the phone.
Really?
Our family, that's kind of weird, but
That's because I'm assuming it doesn't hurt.
no, it doesn't hurt. And this patient is a young patient. She's in her early or mid-20s. She has this, she's thin otherwise, but she has a little extra around the midsection. And this shot coming up is a 6-week shot post-op,
Oh
and you
my
can
goodness.
tell with the laser-assisted lipo how happy she is and how much better she looks.
You know, for her, that was probably a problem area that working out couldn't get rid of.
It's kind of an isolated area that she was really upset about it.
Yeah. So then it's actually more affordable than traditional liposuction as well, right?
Well, being that you don't have to be in the hospital, you don't have to pay hospital fee, anesthesia.
Huge difference.
You just come into the office and it's taken care of.
Huge difference. And then how long do results last? I mean, it could be your whole life, really.
Just don't eat a lot.
Well, you
and
know,
exercise and you're set.
There's a lot of people out there that would be very good candidates for smart lipo.
Yes.
So it's kind of nice because it gives people some hope. You know, if they couldn't really afford traditional liposuction and surgery.
Yeah, what it is an outpatient. Again, you can go back to work the next day or the following day. All these things, plastic surgery has trended that way.
Unbelievable. So you can go from an 8 to a 10 in just one weekend.
Yes.
All right, Dr. Thomas Jeneby. For more information, call him 270-8595 or go online, drjenebeplasticsurgery.com. Good information. Thank you, doctor.
Thank you, Lauren.
Thank you, Mary. Thanks for
Thank
sharing your
you.
story. All right, stay with us. We'll be right back.